I just wanted to talk to you about heartworm disease and prevention, as this is Heartworm Awareness Month. We'll touch a little bit on internal parasites as well, just because the heartworm preventatives we generally use prevent those as well. If you do have questions during this, don't hesitate to ask. We'll answer those as we go if you do have them. And so I do have some slides. It just kind of explains what I'm going to talk about, has some maps of heartworm incidents in Idaho. Heartworm, the first question we need to understand is, how do pets get heartworm? And so it's really a mosquito-transmitted disease, and it's primarily a dog disease. So an infected dog gets bitten by a mosquito, it picks up the microfilariae or larva of the heartworm, comes and bites another dog, and then after the 1 to 3 weeks that it was in the mosquito, it's mature enough to infect the next dog, just going from the mosquito's disgusting spit into the bloodstream of the bitten dog. And then 5 to 7 months later, that dog has adult worms in the blood vessels and the heart, creating heartworm disease, making more baby heartworm, so the disease can go on to other pets. So this is just kind of a visual of what that looks like. Again, from the blood to the mosquito, back into another dog, and then from that dog on to others. A great source for any parasite things you want to know is the Council for Parasite Control, the CAPC, on the bottom there. And then I think big misconceptions I get every day in the exam room are people want to tell me that heartworm's not a problem in Idaho. They tell me I only need to give it in the summer months, and then that it only prevents heartworm. So those are all definitely misconceptions. Every 50 states in the country have seen heartworm. Of course, some do have larger percentages than others, but it is a fatal disease. It's easily preventable, so there's no reason to not prevent something when we can. Climate change is definitely affecting when mosquitoes get active, how long they're active. Mosquitoes can stay alive in warm places like our house or garage, so they're not going to die off as quickly as we might expect. And other worms like the hookworm and roundworm cause disease, and the heartworm preventatives we give prevent those as well. And so I just wanted to kind of show how heartworm has changed in Idaho. In 2010, you can see Idaho is perfectly white, so there was less than 1 case per clinic. Not every clinic even is reporting, so that's still probably underrepresented, but we were pretty much feeling pretty good about ourselves. And then not quite 10 years later, you can see most of Idaho has gone in from 5 cases per clinic. That's not per state or per county, that's just per clinic reporting. And again, I think underreported because not every clinic reports, and there's plenty of dogs that never ever see a vet, and they could have the disease and be vectors to spread to others. So just in 10 years, that's what we have seen change, and obviously I think that's only going to get worse if we aren't trying to be proactive and prevent the disease from happening. And so the fatalness is really heart failure. The worms basically are causing congestion in the circulatory system, and they'll start coughing, having signs of heart failure, and ultimately can die if we don't figure that out. If you do figure it out before they get clinical signs, treatment is deep injections into the muscle. It's not very comfortable for the pet. They're at high risk to have emboli from dead worms, little clots kind of floating around in their blood vessels, so you have to restrict them so they don't get to run around and have fun and play. So it's a pretty miserable treatment for the pets, and the treatment is way more expensive than prevention, for sure. And so how do we prevent it? Really, you just want to make sure your pet doesn't have an active infection that should be treated. That's a quick, easy blood test, and then you can either give a tablet once a month on the same date, or now there's a super convenient option to just get an injection once a year, and then you're done. It doesn't really get any easier than that. And then we've mentioned a little bit the internal worms, roundworm and hookworm, and so those are the 2 most common parasites that we would see here. And again, the preventatives we're giving for heartworm does take care of these. Every puppy pretty much has roundworm. When they come from mom, they get it in the uterus before they're even born. And so we aren't meant to get roundworm, but sometimes it will pick it up. It can migrate to places that we don't want it to go, like to the eye and things like that. So if we deworm the puppies, then children in the household aren't going to pick that up either. And so even though we deworm as puppies, if they get reinfected from eating poop in the environment, we want to be proactive year-round with that. And then hookworm is the other one. Often people are surprised in the exam room when I tell them that that parasite can go up through the foot pads. And so they don't have to be eating the feces of another dog, they just have to walk through where it was. And that definitely can cause problems, even anemia for dogs. And then for people, we can get kind of a rash or plumber's itch if we get exposed to that parasite. And so, again, the heartworm preventatives cover that, and some even cover whipworm, so you're even getting more coverage there. Kitties, they can get heartworm, but much less likely. Their immune system seems to fight it off. Definitely, if you're concerned about that, want to prevent it, Revolution Plus, great product, once a month on the back of the neck, and they're covered as well. All right, well, thanks so much for joining me today. I hope that answers your questions about heartworm disease in Idaho.